Hey friends, it's Beth here, Aging Care Solutions, offering both professional guidance and personal caregiving and family experience to help guide you as your aging care coach. One of the things that I seem to be running into as I start this journey on YouTube is that I have a lot of experience with different things, not only in my own family, but working with other families, setting up services, making recommendations, helping make phone calls and recommendations and referrals to them for certain things that they could be using to help folks who have a different normal now. This topic to me, and I'm not gonna cry, as I always say. This directly impacted my life tremendously at a very young age. Well, I consider my 20s young. I lost my dad. He was my big bear. I loved him very much. I was very close to my dad, and it was unexpected for a couple reasons. The first being that we had just lost my brother about 6 years prior. So the day that we were home, and my brother was there, my younger brother was with us too. I had moved back in. I was living in Florida after college, and something told me for almost like a few months, go home. It's time to go home. It's time to go home. And you know what? I'm glad I listened to that. I've had that guiding voice helping me throughout my life, and I'm glad that I did. All my friends, we'd all graduated, and everybody had kind of either gone home or, gotten into their career. And I had too. I had started working. But I was just, it was time for me to go home. I missed everybody. I'd been gone several years, and it was like I really wanted to get back to a Four Seasons type of a state. So I did go back to upstate New York, and I'm glad that I did, because I think it was like about 11 months in that my dad died unexpectedly. It was his birthday, and 5 days later, he died. And it was really a huge shock. I mean, it was not even something. I'm glad I was there. I'm glad my younger brother was there, because we together were able to help support each other during something that, you're just not prepared. And that's really why I feel like I wanted to start this channel, because so many families, none of us have a guidebook. None of us are prepared for, these various crises that we're going to go through with potentially our own health or our families, children, whatever is going to happen. We have to know, what are we looking for? What can we do? How can we make the quickest decisions? And I think a lot of times, the one thing that I do know about most men, they will ignore symptoms for days and days. They could be having a heart attack and they'll still not mention it to anybody. They'll just think they have indigestion, or that they have, pressure on their chest, or their arm is tingling. I think my dad had symptoms. He told my mother that he was not feeling well. I just don't feel well this week. And if he had said, I have bad headache, or I have, different warning signs, I don't think he said anything to anybody until it was that exact moment, when that clot broke loose. And my brother was the one that recognized it immediately. And he just yelled out to both of us. And I, of course, ran next door to my neighbor, who was an emergency EMT. And I went to the other neighbor's house. She was a retired nurse. And it was like the dead of winter. And I ran in my bare feet to my neighbor's houses so that I could get help as quick as I could, because above all else, I knew how important it was going to be for us to call an ambulance and get somebody at the house immediately. It took them a long time. They sat in the driveway. I was so upset. I don't even want to go into it, because it really doesn't really help in any way. However, what I will say is that there are some warning signs that you can look for. And these are things that you should educate. If you've got teenagers at home, I really want my children to have the ability to kind of just recognize certain things, whether it's with a friend who could be choking, or somebody who could be, maybe dehydrated and they're not stable. There's all kinds of different things that I think all of us can do for ourselves and our children But when it comes to people who are older, and my dad wasn't even old, he was in his 50s. The older I get, the more I consider people in their 40s and 50s to be younger. But one of the things that we did that was noticeable right off the bat was the face drooping. So there's this acronym that they use, FAST, F-A-S-T, talks about facial recognition. Does one side of the patient's face, is it feeling numb or is it starting to droop? Ask the person to smile. If they're unable to smile or it's uneven, it is imperative that you make a phone call immediately to get them to an ER immediately. Arm. If one of the arms is weak or numb, ask the person to raise both of their arms if they are unable to do so, or if one starts to drift down because of left or right side weakness. Also, speech becomes impaired, the S part of this acronym. If the speech is slurred or it's difficult for them to say or speak or tell you what's happening, and then time is going to be your biggest friend. That's when you rush into action by calling 911 immediately. And I don't know what you can do other than telling that person to just remain calm, try to keep themselves and yourself calm while you're waiting. And if there's anything else that you need to bring with you, insurance cards, identification, a list of medications, anything that the patient is allergic to potentially, that you'll use those few moments while you're waiting for emergency to come to make sure that you are prepared to either ride in that ambulance or follow that ambulance to the emergency room. If someone's having a stroke, they are on it. And there's ways now, more so than ever before, for them to use blood thinners right away that can help break up those clots before it hits the brain. We knew a couple days in, by talking to the neurologist, he said, this is a fatal stroke. And, I was in my 20s, so I was like, oh. And he said, let me just show you the films. And he said, wherever the white area is where all the damage is. And we both looked up and we looked at this large film scan of his brain, and the entire thing was white. Almost the entire brain had been damaged. And we just knew. We just knew that was it. The odd thing is, he lived a few more days after that, my dad, and I had a really tough time being in that room because of when he was in the phase of active dying. It was very challenging for me. My mother stayed right there the whole time. And his hair turned completely gray along the sides. I remember that because of the damage, I think, to his head and his brain. And he couldn't speak. He had no verbal capacity at all. He was trying to lift one of his legs, and he was showing us that he was able to lift his leg. And it was a really sad time. It was a very challenging time for the entire family. But some of the things that I think are really clear is that that the stroke is going to affect not only the patient, of course, if they survive, and a lot of people do. I mean, I've worked over the years as a senior care specialist, over the last 20 years. I'm telling you, I met with a lot of families and younger people, that have that can be impacted by stroke. Even women that are having babies. I mean, it's just, and I've known people that were in their 30s and 40s that did, and they had complete recoveries, and some people can, but it affects both the patient and their family, but there are coping strategies. There is in-home support as well as all different types of community support that you'll be able to find. But the effects on the patient obviously are going to be physical, cognitive, emotional, and behavioral changes, which will include like physical impairments. I mean, that's the one thing that you will note is weakness or paralysis. It's often on one side. And balance issues, of course, are going to be a problem. Trouble swallowing and speaking, and or both. Cognitive challenges like memory loss, difficulty concentrating, impaired judgment. I had a meeting with a family, and I met with a daughter. The daughter had moved in with her mom right after she had her stroke to help support her. And it was fascinating because during most of the meeting, every time the client wanted to speak, she had to close her eyes So we were having a meeting, and she would talk just like this. She was able to form sentences and speak clearly, slowly, but she had to have her eyes closed. And I was just so fascinated at how the brain functions and works, and what a miraculous tool it is when we have our mind, and how it tries to repair itself when something happens, like you take a hit, like a stroke, or, like a dementia, or, a traumatic brain injury, which I consider stroke traumatic brain injury, even though it's internal. It's not like an external car accident or fall or, something like that. I'm looking at my notes too, by the way, but emotional struggles like depression, anxiety, frustration, personality changes, absolutely. A lot of families that I worked with told me that, and I could see why, because a lot of men are very self-sufficient. They are the head of the household. They are the, you know, usually the provider. And for them to be so vulnerable, even men that have heart attacks, oh my gosh, there comes a time when during recovery when the emotions are just bubbling, and it's not even something that they're conscious of. It just starts to happen because that's just a way of coping. It's a way for our body it's almost like active grief for who you were and who you are now, right now, with these changes, these physical changes that you're going through. And of course, aphasia, which is communication difficulties, trouble understanding and using language. There's different types of cards out there. I don't know who I ordered them for. I think I ordered them for one of my families that I love to go visit. I ordered them off Amazon, and they were little cards with faces on them that said happy, sad, frustrated, and then it had a host of all these different things that you wanted to do. So sometimes a stroke patient is able to read, but they are unable to speak that. So they might find a thing and say they want to go outside, or they want to go for a ride in the car, or they want to, so there's so many different types of tools that are out there. And of course, the effects on the family, it's going to be shock, grief, stress. I'm going to start crying. And sadness. About the sudden changes that your life and your family is going to have to deal with. Now, if your loved one survives this, which, like I said, many people do, there's a lot of role reversal, right? So your wife or your husband will now, or your children will now become the caregivers. And it can be overwhelming for people who are still working or raising their own children. I wasn't even married. We were in our 20s, my brother and I. And I'm not sure if he was home from college while we were all there, but they were watching a hockey game, and that's exactly when it happened. My dad was probably smoking with the window open because it was too cold to go outside. It was January in Syracuse. And he started coughing. And that's exactly what I remember, is that I heard my brother yell to my mother. And then right away, I didn't even go in to see him. I just ran next door to get two people to help us immediately while my mother called 911. So that immediately the role reversal was there. It was overwhelming initially, but within the 4 or 5 days that he lived after that, we pulled together to help each other. Now, as far as financial strain, as far as the effects on families, emotional toll, role reversal, potential financial strain. My dad was still working, had been working at his job at the same company, the power company. He had been there 31 years. And he hadn't even gotten a chance to retire. I know he had a dream. He loved fishing. I know he had a dream to relocate and come to Florida. They loved coming to see me down there. And I think they wanted to potentially buy a place down there and bring his boat down and do all these other things. But as far as medical bills, my dad had great health insurance through the company that he was with. But it was a loss of an income and the loss of a true partner and somebody who was a huge part of family and maintaining that household, staying there. Now, my mother was very smart with her finances, and she was able to stay there for until the very end, until I moved her because she had dementia, many years later. I think she was there 91, 2000. I can't, I can't even do the math right now. I think she was there 25 years, maybe 30 years before I moved her. And then time demands, coordinating care, attending appointments with your loved one, and providing supervision. That's where I would come in many times as a service provider, helping families coordinate around time so that family members, like a spouse typically, would have free time for themselves to go do the grocery shopping, go and do their own doctor's appointments, meet up with friends for coffee or lunch, try to go, maybe they, wanted to do something like take a walk and they really didn't want to leave their loved one alone. So there are a lot of different services out there. And as far as ways to, for the patient to cope, a lot of times getting them into therapy, rehab therapy immediately, as soon as they're cleared from their doctor, with physical therapy, occupational therapy, speech therapy tailored to their recovery, is not only a way for them to feel purposeful, it brings that, they're around younger people, they're seeing other people at these facilities that have had a similar incident like a stroke or a traumatic brain injury. And it also brings routine, like a daily structure, which helps rebuild independence and confidence, and it gives them something, to look forward to. I'm sorry, this piece of hair is bugging me. I could see it. The other thing that I don't think my mother did this, it's really weird. When you're really private, you have your core group of people. I've talked about the circle of trust. But when you have a couple good friends and your friends have also lost their husbands at a young age, they rally around you. And if you've got a good support system, maybe you've got siblings, if you're a woman, and maybe you've got a sister or cousins or anybody that, already knows what you went through. So you don't have to keep telling your story over and over and reliving the sad, shocking new changes that have happened. But some people find that in support groups, right? They'll meet for coffee, or even there's recovery groups for the stroke patient as well. Because, this is new for them and this is new for really everybody. So, sometimes people will find these support groups online. Other times they'll do it in person. My friend Mary Beth ran her church group. She's a nurse and she worked for Mother Seton Church here right by us. And that's where they helped support patients who were having, their older parishioners who were coming in and were having trouble, just finding people to talk to about things. So they started support. So it might have been that one person's wife or husband had cancer, or someone else is dealing with someone who's really not well, or had a stroke or passed. They were all there supporting each other and whatever they were facing as far as illness or decline in health or just the whole aging process. But also for the patient, setting small goals and achieving those or celebrating these with certain things is such a huge thing. I've seen patients that are coming home with full-on walker, needing all assisted devices, needing assistance with feeding and everything. And all those milestones, as they improve, as they get stronger and start to rebuild their bodies, and seeing the next time you see them, they're using just a cane. It's just wonderful. It is a wonderful thing to celebrate those milestones, especially for the patient. And that's why you'll see sometimes when people are leaving after treatments, they're ringing that bell really loud because they are psyched. They know that they made it through. They know that they are on a healing path, and that this has changed their life. A lot of times it's very profound. I think a lot of times people are so grateful that they survived something like this that it brings them more joy to have whatever time they have left, right? They're really embracing doing things that they maybe put off because they were still working or because they just felt like, oh, we'll get to it. No, it's like just doing it when you have the time and you make the time to do it and create, these happy moments or these, celebrations of parties and birthdays and these milestones. It becomes so much more important. And for the families, education. So learning about stroke recovery and what to expect. There's a lot of information that's on there. There's a lot of, I used to hand out pamphlets. There's a lot of different things that you should be able to get from your case manager at the hospital when you initially go in. they can be a very good resource for you. They've seen this, they've been through this, they know, who all the neuros are that are going to be working with that patient until they discharge them. Likely your loved one will go to a subacute rehab, and I would do a little bit of homework on that. In this area, there is one of the best rehab hospitals in the state of Maryland, and it's part of the Adventist group of hospitals and facilities, and it is amazing. It's the number one place for people to go if they've had a traumatic brain injury or a stroke. And if you can get a bed in there and do your rehab in there for a number of weeks, and your insurance will cover it. So if you can, when you're doing your research, find a rehab hospital setting in your area. That's where you want to go, because that is the A team. Those are the people that's all they work with is brain injury, brain trauma, stroke. And they know how to work with people. They have the best PT, OT, speech therapy, all of it. But there's also a host of wonderful people that will actually come into your home. So I don't believe that you can do both. I think once you get home from rehab, you can either go to an outpatient facility, which means you're driving your loved one there, or they can come in and be covered under your health insurance. So you're going to want to consider which one is most convenient for you. But that's going to come with educating yourself, finding out and taking breaks so that you can prevent burnout and your own exhaustion, which is going to be upon you, especially in the first several weeks. And seek out counseling. Individual or family therapy can be really helpful during a process like this. And what's really nice about now, since we've all come out of COVID, one of the things that really has been very, very helpful is online support. Like from the comfort of your own office or your bedroom, you can talk on the phone with a counselor that can help you, give you different tools that you'll need in order to get through this new change to your family. So the counseling could be something that you maybe have not thought about. I know so many people, and myself included. Really, I went my entire life with so many things that I should have really sought help for. It took until the breakdown of my marriage for me to look for help, when for years and years there was other issues that I should have probably really taken care of. So I encourage you to not think anything of asking and reaching out for counseling if your insurance allows it. And you can be paired up with someone that specializes in health crises. And you can also join a caregiver support group. I know I talked about one for the patient or the person who's going through this big change in their health, but also the family. Shared experiences and solutions that other people have been through. They can even tell you things that worked for them, that didn't work, why they put a ramp in, why they chose to do this, why they moved. That you're going to find all kinds of little things that are going to be super helpful. And that's sort of why I feel like I'm supposed to be doing this. I'm supposed to be helping you and other families, because oddly enough, I've lived through so many of these, right? I still consider myself young, but when I turn around, I'm like, oh my God, this is it. I'm in my 60s now. And I really feel like I want to share my experiences and my knowledge, my healthcare knowledge in this industry to help you. And you can share this information if you're watching this right now and your friend who lives in Canada or in, Dallas, Texas, whatever, has just gone through this with their parent, just send it so that they have, and they're aware of, what options are out there. And one of the things as far as in-home services, this is something that I did for years, and that is home health care, right? So, that I worked for a hospital-based system. And one of the things that we offered and that I set up for a lot of different people is skilled nursing care. What skilled nursing care does is it allows someone to come in and check surgical site, check the patient, meaning they're going to do everything from listen to your heart, take your blood pressure. They're going to be able to assess any wounds. They're going to be able to assess your overall, they're going to be able to do medication management. They're going to be able to oversee your physical, they're going to be able to make recommendations for your mental health and any chronic conditions that you might have other than what brought them there, which is the stroke. But they can help make recommendations on if your blood pressure is getting better, improving, and maybe you've gone to a lower dose, or if they've put you on new medications since you've had this incident with the stroke. they're going to help make this transition a lot easier by coming in, seeing how you're doing. And I would suggest if you are the primary caregiver, is to keep notes, like see how did that first couple weeks go when your loved one was home? How did they do? Like how was their intake of food, their intake of hydration? What changes, what decline are you seeing, or what improvements are you seeing? And you'll share all of that with the nurse. And you're typically going to get the same nurse to come back every single week to see you, or every couple weeks to see you. But you'll also qualify for personal care assistant, meaning if someone needs a bath or a shower, assistance with dressing, toileting, and grooming. Now, that personal care assistant will not be coming in daily, but you could pay separately for private duty nursing to have someone come in. But this would be covered under your health insurance. So I would take advantage of that and know that, okay, Medicare or whatever is going to cover my a visit twice a week by someone to come in for a shower. Perfect. But remember, you're going to need some equipment for all of this. It could be a raised toilet seat that you'll need. You could need a safety shower seat in the shower or the bathtub. Bars, of course. Safety bars are going to need to be not the suction cup ones, but they're going to need to be hard mounted into various parts. You may even consider a railing down the hallway from a bedroom into the main living area. There's a lot of different things that are out there now. Barca loungers or recliners that now raise to a full standing position. There's a lot of different things. You may consider like a meal prep service, or even asking your family members the first few weeks that you're home to help with meal preparation. This is kind of off topic, but when my twins were born, a friend group of women that I did yoga with and whatnot, they prepared 12 weeks worth of meals, and everything was put in the freezer. So every week I was able to pull stuff out, and it was so awesome. All the instructions were on there. So something like that could be a real assistance to anybody, that's home. And there are meal services that you can order, and homemaking services like housekeeping, laundry, grocery shop, and errands. Again, these are private duty agencies that could help you. You may only have them twice a week or 3 times a week, but a private duty nurse, if you get a really good caregiver, they are worth their weight in gold and you might even just ask a neighbor or somebody, hey, I remember when your husband was still living that you had a really great caregiver. Is she still doing that? Or you might live in a community where there's like a bulletin board and you can find people who are sharing a caregiver. If you live in a high rise or in an apartment, 55 and over. If you're in your own home, there's services out there. There's plenty of them. All you have to do is look, Google it and just say private nursing in my area. And they might be called home care agencies in your area, home care. So they could come in and they could do little things like cleaning the bathrooms and, doing light housekeeping, but also stripping the bed linens. If you're sleeping in separate beds, making sure that room, his or her room, has all the things that are needed bedside, right? You're going to modify with certain things like medical equipment, wheelchairs, walkers, grab bars, things that I just mentioned. Hospital beds, I would say, the first several weeks at home, very helpful because you can raise it up and down. It's going to be a lot easier to get your loved one up and out of bed into a wheelchair if that's necessary. There's lift chairs. And then any home adjustments and modifications that you can make for safety and mobility. But these are some of the things that will keep you in the home too, so that you don't have to, because you've already been through something, right? The last thing you need to do is think about having to move. I'm going through that right now. I'm going through the moving part, and I've needed every bit of these 3 or 4 months to try to get organized. The other thing that home health offers you under your health insurance is case management. So a social worker is going to be able to help really with the aspects of adjusting, really, and making, finding resources that might assist. They can assist with insurance or long-term care planning, or a nurse that can do care coordination for you. So yeah, there's a lot that they can do, case management, and it's all part of that. And it's all under that moniker of home health. Also, don't forget that there's telehealth and remote monitoring. So, your doctors, you don't have to necessarily always go into the doctor, because it can be very challenging to get somebody in and out of the home, in and out of the vehicle. But you can do virtual remote check-ins with not only your doctors and specialists, but with therapists. And there's also devices that you can monitor through, your vital signs and things like that at home. And it keeps track of them. I know I had to take my blood pressure when I was pregnant with twins. And I'm telling you, somehow we sent all that information electronically through the phone. This is way back in the day, 18 years ago. But still, it's amazing what devices and technology is out there now to really help keep us safe, keep our physicians more informed. So some of the other things that might be available to you are volunteer groups in your area, or even faith-based from your church that can potentially help you with transportation. Some groups, right when you get home, will provide companionship, meals, spiritual support, so that if your loved one is the one that has had this stroke, then you're able to get out and allow someone to be at the house, keeping them company, just having a good visit, maybe preparing a meal or sitting with them, praying with them. So there's a lot of different things that can be done. I think when you do, I don't know about you, it's hard for me to ask for help. It always has been, because if I need something moved, or if I need like a piece of furniture, or I need the trash brought out, I don't have a problem asking for that. It's other big life change things that I really just rely on myself for that. And I don't want you to do that, especially if you've had something like this and that you're in the midst of your loved one recovering from a stroke, or you yourself are in the midst of recovering. It's a long-term journey, and you want to be as patient with yourself and your loved one as much as you can. It's the one thing that I will say is that for both the patient and the family, early intervention, emotional support, and access to the right services are going to significantly improve both of your qualities of life. So I would encourage you to reach out and find out what your insurance covers from a home-based support care and medical care, and then reach out to other area agencies about support for transportation, visiting, any volunteer services that you might have access to, because it would be really helpful for you to have a friend during this time, and friends to help you on this journey. So thank you so much for listening to this. I know I got upset a little bit, but you know what? It's because of the nature of who I am, things that happened 30 plus years ago, like with my dad and with my family, it still resonates with me, because I had such love for my dad and my family, and I know how it impacted all of us so greatly. It changed our lives forever, but it also brought the three of us closer together. So anyway, I wish you all the very best if this is what you're going through. And if you have any questions, comments, if you want to subscribe or share, I'm truly grateful that I can support you during this difficult time. Take care. See you at the next video.